since this is not the first presentation regarding autism spectrum disorders, I will not start my presentation from the beginning. I will start it from the problem of sexuality. Well, sexuality is important for mental health. So sexuality and autism spectrum disorders regarding female population is somehow neglected topic and neglected area, not only in the research articles, but in society as well. So sexuality is a fundamental and component of human experiences. And it is normal part of everybody's development regarding age, religion, race, and things like that. It is a standard of life. It is a way of how we behave. It represents our body movements and behavior. And as they said, it is lifelong. Well, everybody is born with some kind of sexual feelings and experiences, because we all know some psychologists from the past and psychosexual theory that is focused on psychosexual development, and it is composed of 5 stages: oral, anal, philiac, latency, and genital stage. So as you may see, you may remember that when I was talking about female population and autism spectrum disorders, sometimes they don't understand social cues, and they are becoming of a peer social group without understanding things, and they are doing things they are not they are thought to be okay. So sometimes they feel they are a victim of abuse, sexual abuse, because they think they have to do all those things in order to be accepted. And sometimes, persons with disabilities are the more often victims of sexual abuse because of the communication delays and deficits, especially persons with autism spectrum disorders. So sexual well-being refers to emotional, social, mental, and physical well-being. And as a sociologist, Edward Lauman said that sexual well-being is a cognitive and emotional evaluation of someone's sexuality, how they feel, how they behave, how is their quality of life. And sexuality refers to not only to physical psychosocial well-being, but also to physical well-being as well. It is important for someone's happiness, stress reduction, and things like that. And it has health benefits as well. So persons with disability in general are thought to be non-sexual beings, so they are not satisfied with their sexual experiences. I mean, sexuality is a taboo topic and in population in general, and it is thought to be a sinful behavior. And in literature says that persons with disabilities are thought to be a third sexual gender. I mean, they are thought to be non-sexual people. This is the reason why legal documents are focusing everybody's attention on sexuality, and Agenda 2030 is made review about sexual rights and sexuality of persons with disabilities, and concluded, I mean, even before Agenda 2030, they concluded that sexual rights is a human right. I mean, everybody has that biological way of behaving, and it is something that defines people. And I'm sorry, in this review analysis, the United Nations are not satisfying with the results because sexual rights are not met in persons with disabilities. When it comes to research articles regarding general population and attitudes towards sexualities of persons with disabilities, I mean, attitudes are normally positive, but this is not something that they are facing with. I mean, they're not having person with disabilities in their families, and they do not face these disabilities. And because sexuality is important, there are research journals that are focused on sexual education and sexuality of persons with disabilities. So I would like to say something about domains of sexuality of persons with autism spectrum disorders. Well, there are 3 domains of sexuality in persons with autism spectrum disorders. Behavioral, I mean, how they feel, how they express their sexuality. Sexual selfhood, are they recognized as sexual? Do they perceive themselves as sexual beings? And socialization, do they manifest sexual behaviors, and do they recognize those sexual behaviors? Because research article says that they perform sexual behaviors as the same age as their peers. So the main goal of this research was to raise awareness towards sexuality, not only of females and persons with disability, with autism spectrum disorders, but disability and general population as well, and to see how are what are attitudes towards sexuality of females with autism spectrum disorders, because we wanted to see if this population is neglected, how is other taboo theme recognized in this area. So since coronavirus and pandemic, we had several limitations. So we conducted research online on a Facebook page of parents with children with autism spectrum disorders. So this was online survey, and we used and translate attitudes towards sexuality questionnaire of Greek researchers, Cuskelly and Gilmore. Only 16 participants participated, but despite that low number, we decided to talk about this subject, because this is one of the steps to raise awareness toward sexuality and to crush down the taboo of sexuality of persons with disabilities. I mean, only 16 parents, mothers participated in this article, but we have registered 546 females in Croatia, autism spectrum disorder females in Croatia. Well, this questionnaire have several domains: socio-demographic data, sexual rights, parenting, non-reproductive sexual behavior, self-control, preparation, and responsibility. And the reliability of this questionnaire is, I mean, very low. 0.5455 is Cronbach's alpha. So the most represented age of the participants was 50 to 59 of the mothers, and most of them have a college degree. And the age of their daughters with autism spectrum disorders is 10 to 18 years old. So we find general attitudes towards their sexuality generally positive, but we find deviations regarding emotional relationship, because most of them think that their daughters cannot be a part of emotional relationship, and they need to use medication to lower their libido. They are not for masturbation. And they all think that they should be included in sexual education, which is lacking in Croatia. And they do not think that their daughters could be married with other people with disabilities. So we find these results generally positive, but these deviations, we find it because we understood that because mothers are overprotecting their daughters, because they're scared how will they sexually behave and how will they understand this sexual behavior. I mean, I already noticed that the main limitation is the low number of participants. And I mean, maybe the low number of participants is because some of them didn't want to be a part of this survey, because some of them may have negative experience towards sexuality and didn't want to be a part of this research. So we have some recommendations for practice and future research. I mean, this research should be conducted again, but after sexual education is implemented in curriculum, but not only sexual behavior, but menstrual cycle, hygiene, behavior in intimate areas and among crowd as well. And we need to allow these females to be sexual and to have to satisfy their sexual needs and sexual rights. There are positive practices of sexuality in the world. We are all aware of practice in Netherlands, well, with their red light districts and streets. This is the quote of a person with disability regarding their sexuality in the Netherlands. He says that the beauty of the sex care in Netherlands is that you can freely go on a journey to discover your sexuality without feeling shame or guilt, because you are human as everyone else. Well, this topic is recognized as needed to be focused on, and that is why there were some projects that were focused on sexuality and sexual education of not only persons with disabilities and autism spectrum disorders, but their families as well. And they, as I already mentioned, there are research journals that are focused only on sexuality of persons with disabilities. I hope this was not that long presentation, because I know I'm the last and I know you are already tired. So I wanted to thank you for